Good morning, this is me Nafisa. Today let's understand what is hypertension. Hypertension during pregnancy is a critical condition, can affect both mother and the baby. As hypertension during pregnancy causes complications for the mother and the fetus. Also, let's learn four main types of hypertension during pregnancy. So let's get started. Well-being of the mother during pregnancy contributes to the overall health of the mother and the baby. High blood pressure or hypertension is a common condition that affects the body's arteries. Blood is carried from the heart to all parts of the body in the vessels. Each time the heart beats, it pumps blood into the vessels. Blood pressure is created by the force of blood pushing against the walls of blood vessels, that is, the arteries, as it is pumped by the heart. If the person has high blood pressure, the force of the blood pushing against the artery walls is consistently too high. The higher the pressure, the harder the heart has to pump blood. Blood pressure is measured in millimeters of mercury. In short, we call it as mmHg. In general, hypertension is a blood pressure reading of 140 by 90 millimeters of mercury or higher. Hypertension is a serious medical condition. Some women have high blood pressure during pregnancy. High blood pressure is the most common medical problem occurring during pregnancy, complicating 1 in 10 pregnancies, that is 10% of pregnancies. Hypertension during pregnancy is a critical condition, can affect both mother and the baby. As hypertension during pregnancy causes complications for the mother and the fetus. Complications during pregnancy can have a long-term consequence for both mother and the baby. Hence, it is important to address these conditions. Hypertension in pregnancy is a serious condition that requires special attention. Following are the complications for the mother caused by high BP during pregnancy. Preeclampsia, eclampsia, stroke. Preeclampsia and high blood pressure increase the risk of placental abruption. What is placental abruption? That is, the placenta separates from the inner wall of the uterus before delivery. Severe abruption can cause heavy bleeding, which can be life-threatening for the pregnant lady and her baby. Sometimes the mother may have to deliver the baby early to prevent life-threatening complications from high blood pressure during pregnancy. This is called as premature delivery. High blood pressure increases the risk of cesarean birth. If blood pressure goes up during pregnancy, it can place extra stress on the heart and kidneys. Hence, high blood pressure can damage organs such as the heart, kidney, liver, eyes, and other major organs, like having a stroke or developing a heart disease soon after delivering the baby. Developing diabetes or high cholesterol levels later on in life. Moreover, having preeclampsia might increase the risk of future heart and blood vessel, that is cardiovascular diseases. Following are the complications for the fetus caused by high blood pressure during pregnancy. High blood pressure may reduce the blood flow to the placenta. If the placenta doesn't receive enough blood, as a result, fetus might get less oxygen and less nutrients to grow, leading to slow growth of the fetus. This is called as intrauterine growth restriction. Or low birth weight, that is, a baby is born weighing less than 2.5 kgs. Or premature birth, that is, a birth that happens before 37 weeks of pregnancy. Babies born early may have increased risk of infection, breathing problems, etc. Or sometimes the baby may be a stillborn baby. Or the baby may die within the first few weeks of life. Four main types of hypertension during pregnancy are chronic hypertension, gestational hypertension, preeclampsia, eclampsia, chronic hypertension with superimposed preeclampsia. Each has its unique characteristics and diagnostic criteria. Chronic hypertension means having high blood pressure more than 140 by 90 millimeters of mercury before pregnancy or before 20 weeks of pregnancy. Chronic hypertension is typically associated with normal levels of proteinuria. Gestational hypertension happens when a lady has high blood pressure 140 by 90 millimeters of mercury for the first time after 20 weeks of pregnancy. There is no excess protein in the urine, and there are no other signs of organ damage like heart or kidney problems. Gestational hypertension is also called as transient hypertension of pregnancy or chronic hypertension identified in the later half of pregnancy. This terminology is preferred over the older but widely used term pregnancy induced hypertension because it is more precise. Preeclampsia happens when a woman who previously have had normal blood pressure suddenly develops high blood pressure of 140 by 90 millimeters of mercury after 20 weeks of pregnancy. Preeclampsia is characterized by the presence of significant proteinuria, that is, has protein in her urine. In addition to hypertension and proteinuria, preeclampsia may also be associated with signs of damage to other organ systems, including the kidneys, liver, blood, brain, and symptoms such as severe headaches or visual disturbances. Some women with preeclampsia can develop seizures. This is called as eclampsia. Eclampsia is a medical emergency. Chronic hypertension with superimposed preeclampsia. This condition occurs when chronic hypertension leads to worsening of high blood pressure during pregnancy. People with this condition may develop protein in the urine or other complications. Early detection and accurate diagnosis of which type of hypertension is very important for appropriate and effective management. The good news is that high blood pressure is both preventable and treatable. Having high blood pressure during pregnancy needs close monitoring. However, with good blood pressure control, pregnant lady and her baby are more likely to stay healthy. Early detection and proper management is important to prevent complications and ensure healthy pregnancy. Thank you so much.